Well, hello there, Department of Behavioral Health. Those of you who have signed in to YouTube Live, our apologies for starting a couple of minutes late. We are having technical difficulties. We're having some spotty internet connection. So if you're watching live in YouTube and it goes in and out, we believe that the recording of the broadcast should be clear, and we'll send that out as per usual after the broadcast. So my apologies if there's any disruptions to those of you watching live. We'll move right along. We're going to try to go quickly today. We're moving to our September acknowledgements. We have Recovery Month, an important acknowledgement of the journey that persons who are in recovery and working recovery go through. It's a very important journey, and I know here in the Department of Behavioral Health, we come alongside many who are at various stages of recovery. I know I also have folks in my family in recovery and at various levels of their progress toward how they're defining recovery. So for those of you also impacted, I hope you take a moment in the month of September to really celebrate recovery and all that it means. And thank you to all of you in our substance use disorder services, as well as those who provide co-occurring services for joining me in acknowledging Recovery Month. Suicide Prevention Month is also September, and the week of the 7th through the 13th was Suicide Prevention Week. I know we have a walk out at Fresno Woodward Park this Saturday, which I'll talk about in just a moment. And our prevention team has been out in the community at schools and many other convenings. They'll be out at the zoo coming up soon. I don't think it's past. It's the Zoo Boo activity where they'll be providing information on behavioral health services to the community at that event as well. So much appreciation to their work. Next, we're going to talk a little bit about Administrative Policy 81. If you've seen the YouTube presentations that we do here, typically my slide when I do acknowledgements has a few more items each month. And as you saw, I only had 2 acknowledgements for September. And the reason for that is that on September 9th of this month, the Board of Supervisors passed a new administrative policy. It's Administrative Policy 81, and it's about departments, celebrations, and recognitions. So the board policy requires that the Board of Supervisors have a resolution or a proclamation by a majority of the Board of Supervisors before any department can officially and publicly celebrate or recognize any holidays, themes, events, days, weeks, months, etc. Now, the county paid holidays are already Board of Supervisors endorsed, so those do not require additional board action. The proclamations or resolutions that are brought before the board would be valid for up to 5 years unless a majority of the board were to rescind that approval during that 5-year period. There's a provision in this new policy that the county administrative officer, Paul Nerland, at his discretion, should he believe that the board would approve something, but there's not sufficient time to make it through the gauntlet of getting an item before the board in order to have an acknowledgement or a celebration, the CAO at his discretion could approve contingent, he could approve it, and then subsequent, the board would ratify that. Those would be infrequent circumstances. But you may have seen, for example, that the county sent out a Pink Day notification, which is in observance of Breast Cancer Awareness Month, and county employees are encouraged to wear pink and take photographs. And the reason that this was sent out, even though we have Administrative Policy 81, is because in the County Administrative Officer's assessment, the Fresno County Board of Supervisors has approved a proclamation every year acknowledging Breast Cancer Awareness Month in the first board date of October. And it is on calendar for the October 7th board date, and that's why that communication was sent out to all county. That was sent out this week, actually. So the next steps for the Department of Behavioral Health is that we have gathered our monthly acknowledgements that we've been doing all the way through many years now, and we'll be submitting that to the County Administrative Office and working on one or more board agenda items. I want to thank everyone for your patience. Those who have been following this policy, there's probably more questions than answers. I did have our DBH HR team send out communication to the department about decorations because there were questions about that. So we will continue to provide as much information as we have available as it comes to us. Moving to upcoming events, I did say that I would comment a little bit about the American Foundation for Suicide Prevention Out of Darkness Community Walks. That's out at Woodward Park. That is on Saturday, September 27th. And by my calculations, that's this coming Saturday. Wow, we're at the end of September. Where does the time go? Our prevention team will be out there in force helping our community acknowledge the tragedies, which are deaths by suicide, rallying around survivors, folks who've lost someone they care about to suicide, and spreading the word about suicide prevention, access to resources, and access to support. If you're interested in going out there, that is at 9 a.m. and it wraps up in the late morning. And so I'd encourage you to check that out if you don't have any plans in the morning. You also have another option for the day, all the way up until 3 p.m. So beginning at 8 a.m. and wrapping up in the mid-afternoon is Sober Stock. This is Sober Stock number 20. This is an opportunity for the recovery community to rally around one another, have live music. I believe there's a car show and a bike show, speakers giving their own testimony. Many community-based organizations will have an outreach table, including our DBH team. So we really hope that many of you will find it in your day to head on out to downtown Fresno to Eaton Plaza for Sober Stock. And many thanks again to the team in Prevention, Access, Outreach, and Engagement who are supporting both of those events this weekend. Next up, legislative updates. Wow, California legislature is on recess. They worked all the way through into Saturday, September 13th, in order to have their final votes on all of the bills that made their way through the legislative process this year. It's very unusual for them to convene on a Saturday for final votes. You might have heard of some redistricting that California intends to have a proposition. I believe that's Proposition 50, if I'm not mistaken. Don't quote me on the number. But those activities, alongst with other legislative negotiations, delayed the final vote of the legislature until Saturday the 13th. The governor has until, I believe, the 12th of October to sign or veto bills. And in California, the governor does have line item veto as well. So we shall see what happens. I'm going to highlight just a couple of bills that you might be interested in watching. There's a few bills on the governor's desk. The first one is SB 43, authored by Assemblymember Krell. This is about full service partnerships. If the governor signs this, it would go into effect in January 2027, so a little more than a year from now. This would create what's called presumptive eligibility for persons who are experiencing homelessness, leaving carceral settings, and a few other categories. This presumptive eligibility would not require us to kick someone else out of treatment in order to make room for someone who meets this presumptive eligibility, but we will have to see if the governor signs this in the next year ahead, what the regulatory guidance tells us in terms of how we prioritize our full service partnership continuums of care. SB 27 is the next one I wanted to highlight for you. If the governor signs this one, authored by Senator Umberg, it would go into effect of January 2026, so pretty quick here. This one is an expansion of the CARE Act. If you have been following the CARE Act, it is a pathway to treatment for individuals with schizophrenia spectrum disorder, so individuals with psychotic disorders. If this bill is signed, The population diagnostically would expand to individuals with bipolar 1 disorder with psychotic features. So, still keeping the eligibility to individuals with psychosis, but expanding into a different um, classification of illnesses, moving into bipolar 1 with psychotic features. There's also a few other administrative changes, such as the misdemeanor incompetent to stand trial and felony incompetent to stand trial. Judges could direct refer into CARE Act for eligible persons, and a few other administrative changes as well. And lastly, a few bills I thought you all might be interested. Artificial intelligence is a hot topic. We are still waiting for an official County of Fresno policy on the use of artificial intelligence in the workplace. So stay tuned for more information on that in the months ahead. I anticipate that policy probably won't be available for a few more months, but I am interested to see if you all might be able to utilize AI in our workplace sometime next year. But meanwhile, there are also a few bills that I thought you might find interesting related to technology. The first one is SB 243 from Senator Padilla. This one addresses chatbots, which I had to look up because I didn't know what a chatbot was. But chatbots, I'm going to read from my notes here. A companion chatbot is an AI-powered program designed to simulate human conversation and provide companionship, emotional support, and a sense of intimacy with a user. So I wanted to read that because I didn't want to mess it up because I didn't really have the language to describe what a chatbot was. This bill, if the governor were to sign it, introduces protocols for interacting with minors. So these chatbots would have some regulatory requirements for interacting with youth. And that would include protocols around suicide prevention. You may have seen in the media, there was a very high-profile matter where a young person died by suicide, and the family is asserting that the youth was engaged with artificial intelligence, and that they assert has been a contributing factor to that young person's death. AB 56 by Bauer Kahan, Assembly member, relates to social media and would include a black box warning about mental health harms related to excessive use. So, for example, tobacco products many years ago were required to have a black box warning about the potential carcinogenic effects of the product. This would be a similar step, but in a digital way. So we'll see if the governor concurs with the author about black box warnings for social media. And then the last one I flagged for us is AB 1064, also from Assemblymember Bauer Kahan. This one is again related to youth and specifically would limit those companion chatbots being available to children. So a little bit of a different take from this author on children interacting with chatbots. So I hope you found those bills interesting. Sometime in the months ahead, I'll report out on some of the bills that have been signed by the governor. We're just waiting to see what he decides for California. Next, I'm going to give you a brief update on BHCIP Round 2. So BHCIP is the Behavioral Health Continuum Infrastructure Program, and this is Round 2 of the Bond Act BHCIP. And what this is it's competitive grant applications that counties and other entities can submit to apply for funding for capital infrastructure. If you're not new to DBH, you might recall that we applied for BHCIP Round 1 Bond Act, and we did receive conditional awards for 3 projects. More on that in a moment. Round 2 is out right now, and we're working on 4 different applications. And I'm really interested in your input. If you have some reflections on these ideas I'm about to share, you can email me directly, and my email address is right there at the bottom of the slide on your screen. The first program we want to apply for funding is for an overnight stay program / pure respite. You might be familiar with our support and overnight stay program now that it is operated by a contracted provider. We'd like to have that on county-operated property or county-owned property, and there's a building that's on the Olive campus that we think would be lovely for that program. The next one is crisis residential treatment. Those, of course, are licensed as social rehabilitation facilities, but certified for crisis services. We'd like to apply for 2 of those facilities, 16 beds each. There's a vacant lot at the corner of Shields and Millbrook that's county lease to own. That's where we're building out our PUFs and our Crisis Stabilization Center. The vacant lot is across the street on the northwest side of Shields and Millbrook. The other place where we'd like to have a crisis residential treatment facility is county-owned property at the area around Temperance and Kings Canyon. And we would like to develop that property. It's really a very short drive from our Olive campus, and so we think that would be a nice opportunity to have folks get connected to outpatient services as well to be connected into this crisis residential treatment facility if necessary. This would give us the opportunity to expand populations for access to the crisis residential treatment facility. Right now, the only CRT we have a very narrow population that has access to that facility because it's so few beds, only 16 in our entire community. If we were successful to build out more crisis residential treatment facilities, we think it would be amazing to be able to have this as a prevention of escalating crisis rather than stepping down from crisis settings. So we're excited about that, and I'd be interested in your input. Please do send me an email and let me know what you think about that. And then the last one we're looking at is a little bit of a long shot, but we think that a non-crisis social rehabilitation facility is a great need in our community. We have Fresno Crestwood Bridge, for example. It's a small facility. Persons on conservatorship are typically the individuals who stay there. And so if we had the opportunity to develop a 16-bed social rehabilitation facility for a little bit of a longer stay duration than crisis, we think that would meet a need for our adult population quite significantly. And this would be an application to acquire some property that's relatively close proximity to that area of Temperance and Kings Canyon and then build out construction. So if you have thoughts about that, I would be glad to take your input. Again, you can just email me directly on that. You might put BHCIP in the subject line. That would be helpful to me. Next up, an update from our Administrative Operations Division. I have a couple of updates on facilities for you. So I mentioned that our BHCIP Round 1 conditional awards, we had 3 projects. One of those was for the Olive campus. And we're really expecting that program funding agreement to come anytime now. We'll present that to our Board of Supervisors for them to ratify so that we can draw down those funds. That frees up some of our Department of Behavioral Health funding for other projects that we anticipate in the years ahead. And construction is underway at the Olive campus. We are exploring temporary relocation for DBH personnel until Olive is ready. There's been no decisions finalized on that. I want to make sure that folks aren't speculating. I think there might be a few rumors circulating. Here's what's true. We are looking at alternative options for us in order to hold us together until Olive property is ready. We might stay put exactly where we are, but we might do a temporary relocation plan. Again, none of that is finalized, but as I've committed to for the 4 years, almost come December, 4 years that I've been seated before you in the capacity as your director, we will always share information when it's available, when we have something definitive to share. So stay tuned for more information if that happens. Next, I wanted to share that we've had a little bit of a pushback in the timeline for the youth and the adult PUF at the Heritage campus. We anticipate now that construction will wrap up in November. Previously, we communicated that it was going to be wrapped up in September. So I wanted to give you all that update that there's been a bit of a delay in that, but we're very close now. We're at the fire clearance stage, and I'm really hopeful that we'll get through licensing and hopefully we'll have more information about a opening date soon. And then lastly, BHCIP Round 1 program funding agreements are still pending for the other 2 conditional awards. There's a few hurdles that we're trying to overcome with those conditional awards. Remember, this would have been for the psychiatric residential treatment facility for young folks, as well as PUF focused around the SB 43 expanded population of grave disability, including SUD only persons who have substance use disorder only, as well as those who have substance use disorder and co-occurring disorders together. And then one last announcement from the Administrative Operations Division. Staff Development says there's a coming attraction. They will be communicating soon about our compliance refresher training, and you should see information about that through Relias coming beginning October 1st. Good news on the county budget. Give me a little whoop whoop, everybody. We passed the county budget. Not me, the Board of Supervisors passed our county budget, but we, Department of Behavioral Health, we did a great job preparing. 8 departments were selected to present to the board. I'm super excited that DBH was among them, and a big shout out and kudos to DBH finance team and all who assisted in their preparation of the budget. They did a great job. And here's a few key takeaways. Our budget is okay this fiscal year. As you all have heard, if you've been with the department for long enough, you've heard me say we've been under some belt tightening. We've been under some belt tightening for about 2 years now, and as a result of that good work, we are okay on our budget this year. We are preparing and anticipating some impacts next fiscal year. So a year from now, things might look a little different. We'll see. We'll report out, in the months ahead as we continue that analysis. But we're wondering what might be the impacts of the federal changes to Medicaid eligibility. We know that the state budget is evolving, shall we say. So we're looking at state budget projections. And of course, we're implementing BHSA. And so there could be some impacts with that. Emphasizing what I've shared previously, at this time, I have no anticipation of any layoffs in the Department of Behavioral Health. Couple of federal government updates, and I'm going pretty quickly because I know we're a little bit short on time. The federal fiscal year begins October 1st. You might have heard months ago about H.R. 1. It was the One Big Beautiful Bill Act. Not my language, but that was the name of the act. It passed in July, but that's different from the budgetary process. H.R. 1 is what was called a reconciliation bill, and it's mostly about taxes and policy changes. The federal government budget process is different, and that's what we're in the midst of right now. They're supposed to be wrapping that up in the days ahead, but there's a little risk. Currently, the President of the United States and the United States Congress are at a bit of an impasse. They haven't yet reached an agreement, and they have to reach an agreement in order for there to be a federal budget come October 1. That's next week. So time is ticking. They have 2 options to move forward. They either pass all 12 appropriation bills, or they do a continuing resolution, which is basically buying some more time with a temporary funding strategy. This isn't the first time there's been a threat of a federal government shutdown. You may have heard that in the news, many times over the years. But as of today, there is some threat of a federal government shutdown. Now, when they say that, it doesn't mean that the entire federal government shuts down. Things like the military, public safety, and essential functions of federal courts, those things continue. Medicaid remains intact. So, for example, the treatment services that we bill through Medi-Cal, which is California's Medicaid, those services are preserved. Some federal grants might pause, but as we understand it, our substance use block grant and mental health block grant are intact, mostly. And then there could be some challenges to benefits in the community. CalFresh would be okay for about a month, but WIC might be impacted within a few days. None of these things are final yet because there is still the opportunity for there to be an agreement reached within the days ahead. But I wanted you to know that that's something happening at the federal level. One quick update on the Behavioral Health Services Act planning. Remember, BHSA was another component of Proposition 1 that was passed, a long time ago now. Many of you have been involved in mapping of all of our programs and services to new BHSA framework. Our finance team is working to map all of our expenditures to the new framework. We are aligning all programs and services to the required behavioral health transformation goals. Don't worry about taking notes on all of that. We'll have much more deep dives ahead for you, probably in November, maybe December. And then a big shout out to Hong Vo from Planning and Quality Management. She has stepped in as the lead point of contact and coordinator for all of the new evidence-based practices that we're lifting. You can see them up there on the slide, but in the interest of time, I'll wrap things up with a super quick abbreviated version of getting to know Susan. This is a couple of photographs from July. John and I took a trip to Morro Bay. It was my sister-in-law's 60th birthday celebration, and it was a destination birthday party. I'm not super great about taking time off, but I was able to skedaddle, take a couple of hours of annual leave on a Friday to get over there. The picture on the left, I don't know if you can see our squishy faces. After 30 years, you would think that this person that I have spent my life living with would smile for a photograph. This is a long time running joke in our family, but I thought you would get a kick out of it. I have hundreds and hundreds of photographs, and probably 4 of them, John is smiling. So as he did his typical scowling face, the person taking the picture made a big deal and fuss about it. So I did a scowly face too. So I think that one's a framer. I may put that on the wall in my office. I don't know. But John and I on the right-hand side are wearing bike helmets. There was a super cool bike rental place. It was really much more affordable than I expected. We rented e-bikes. Within 5 minutes from walking in the shop, we were on our way. It's a really super bike-friendly community, and we rode all the way out to the end of some trail. It was just amazing. So it was a really great way for me to recharge my batteries, came back super refreshed. And so I wanted to share with you all a little bit of my summer vacation getaway. And with that, we are at 3:30. I'm going to pause here for questions. Alicia Corona is on deck. If you have a question and you're not logged into YouTube and you want to send that to her by email, she will text it to me. There's a little bit of a lag. If you are signed in on YouTube, you can put the question in the chat. I'll check the chat while you all consider whether you're emailing Alicia. I see nothing in the chat.
We won't receive anything today.
Okay, Brian is updating me to say we're not going to receive any questions because of our internet connectivity. I'm so sorry about that for those of you who were trying to watch live. We will try to make sure our internet connection is squared away next time. As you all know, we just got to be flexible, bend like a willow tree here in behavioral health. Thank you for the grace you extend to us when things don't go well. But thank you for watching the recorded version of this director's update, and I will catch you again next time. Look forward to it. Take care and have a great day.